Imagine you or someone you love is critically ill and intubated in the ICU. You'd expect every device around them to support healing. One of the most essential tools, the endotracheal tube stabilizer, can actually cause harm. These stabilizers secure the breathing tube, yet the constant pressure they apply can lead to painful injuries. These pressure injuries form when sustained pressure reduces blood flow to the skin, and with added moisture and friction, tissue damage and pressure injuries can happen in as little as 2 days, affecting up to 20% of intubated patients. Beyond the pain they cause, these injuries can lead to longer hospital stays, increased infection risk, and are a significant workload and burden on nurses. They're also considered never events, meaning hospitals absorb the full cost of managing them.
To understand why this keeps happening, we conducted ethnographic research, including surveying and interviewing more than 30 respiratory therapists, wound care nurses, and ICU clinicians to identify the shortcomings of current stabilizers and the needs of the people that use them. We also have a nursing student embedded in our design team who provides continuous clinical insight, validating our observations and ensuring our solution fits seamlessly into real ICU workflows. We are Team 16 from Bioengineering Senior Design, and we're working to design a new endotracheal tube stabilizer that prevents device-related pressure injuries.
We quickly developed low-resolution prototypes from readily available materials to test key design concepts before committing to final fabrication. Applying them to a mannequin, we evaluated usability, tube adjustment, stability, and contact distribution, eliminating less effective designs and selecting the concept we carried forward. We then created CAD models in SolidWorks and 3D printed in TPU, gathering feedback from a nursing student, respiratory therapist, and wound care specialist to reach our design freeze. From their feedback, we came to a final design concept that features a flexible structure that conforms to each patient's face, foam lining, a slidable tube holder, lightweight straps, an orgastric tube holder, and a large surface area to distribute pressure. This semester, we completed 7 verification tests on our engineering prototype, and all 7 passed. Most importantly, our pressure testing showed a statistically significant 16.5% reduction in peak facial pressure compared to the AnchorFast, a current standard of care. The device also held its position through patient repositioning with zero measurable transverse displacement, kept the endotracheal tube well within a clinically safe range under simulated self-extubation forces, and the bite block withstood over 100 newtons of compression before failure, well above the threshold needed for patient safety. For validation, we recruited respiratory therapists at UPMC Presbyterian to apply, remove, and evaluate the device. Every participant successfully applied and removed the device on their first attempt with 0 critical use errors. In our clinical acceptability assessments, 100% of clinicians rated endotracheal tube securement and workflow compatibility as on par or better than existing devices, with most rating our design as a substantial upgrade over current stabilizers. Over 2 semesters, we've taken this device from an unmet clinical need through prototyping, design freeze, full verification and validation, and even filed a US provisional patent application. The result is a stabilizer that lowers peak facial pressure, securely holds the tube in place, fits seamlessly into ICU workflows, and will one day prevent pressure injuries before they have the chance to form.